Hello everyone, here I'll discuss the histology of renal system. So here what you're seeing is the posterior abdominal wall, then this is the upper, this one is the diaphragm, this is the anterior view. Here you can see the posterior abdominal wall muscles. Here close to that we'll get here this the kidney with this ureter. Then in the anterior of this lesser pelvis you can see the urinary bladder. Then from there from the neck of the bladder the urethra starts. Then coming to this kidney here, this kidney which filters blood and excretes waste products. So the filtrate passes through this renal callus, through this ureter, then ureter. So the ureter carries urine from the kidney to this urinary bladder, which acts as the temporary reservoir of urine. From there the urethra starts, which carries urine from this bladder to the exterior of the body during urination. First we'll see this structure of this microscopic structure of kidney. So it is here, this is a bean shaped organ. It has, this is the outer, that is the cortex, the inner part, that is the medulla. Here we'll get the hilum, there you can see the renal vessels with this renal pelvis, this forms the ureter. Okay. So in this cortex consists of the structural and functional units of this kidney, that is the nephron, with this proximal distal convoluted tubules and collecting tubules. The main structure, this is the renal corpuscles also there in the cortex. Okay. In the medulla, in this part medulla, there you can see the loop of Halley and this collecting ducts with this ascending limb and descending limbs. Then here, this is the structure of the nephron. See here, this is the kidney in the sagittal section. See here, if you take a section from here, there is this is the outer part, this is the cortex, this is the inner part, this is the medulla. You can see in the renal pyramids. Okay. See the cortex here, the arterioles coming into this renal corpuscles. Then from there, this starts this one. From the urinary pole starts this proximal convoluted tubule. Here you can see this is the loop. This is the descending limb of the loop. This one is the ascending limb. Then this is the thin segment. This one is the thick segment. Then you can see here this is the distal convoluted tubules. Here can see the collecting tubules. The collecting tubules of this nearby nephrons just joins to form this collecting ducts. Here it forms here. Then larger duct here. This is the papillary duct, which from here it opens into this minor calyx. Okay. So this cortex consists of this renal corpuscle, proximal convoluted tubule, distal convoluted tubule, and the collecting tubules. The medulla consists of this loop with this thin segments, thick segments, and collecting ducts. Then back to the structure. So this is a part of this cortex. This one is a small part of this medulla also can see. Here you can see these round structures. These are the renal corpuscles. Okay. Then this deeply stained, these are the sections of this proximal convoluted tubules. The lightly stained, these are the sections of the distal convoluted tubules. Okay. So this proximal convoluted tubule, see the proximal convoluted tubule, that is lined with brush bordered cuboidal cells. Distal convoluted tubule here, this distal convoluted tubules, this is lined with the simple cuboidal cells. Then in the medulla, here you can see the loop, thin segments of the loop, this one, these are lined with the simple squamous cells. Here you can see the collecting tubules, these also pale stained. These tubules are lined with the simple cuboidal cells. Thick segments of the loop is lined with the cuboidal cells, simple cuboidal cells. Okay, and this large ducts are lined with the columnar cells. Here also additional to you can see this is the interlobular vein and artery is there. Vein and this one is the artery. Then this is the hyper view of this cortex of kidney. Here you can see this is the renal corpuscle. These are the tubules. This is the deeply stained one. These are the proximal convoluted tubules. Here you can see this proximal convoluted tubule. This one is the proximal convoluted tubule. See the cuboidal cells. cuboidal cells with brush border, these microvilli, brush bordered cuboidal cells. Small lumen. See the distal convoluted tubule, simple cuboidal cells, round nucleus in the center, large lumen. Okay. Then here you can see this, the collecting tubules. See the collecting tubules, pale stained tubules. These also lined with the cuboidal cells. Okay. So the diameter of this PCD, that is 40 to 60 micrometer. It's DCT, that is 20 to 50 micrometer. The loop of Henle, the diameter is 15 to 30 micrometers. Okay. The collecting tubules, the smallest one, they have a diameter of this 40 to 50. The largest ducts, it's as maximum of 200 micrometers. Okay. Then coming to the structure of this renal corpuscle, here you are seeing this is the renal corpuscle. So there is a capsule there outside. Okay, that forms, this is the Bowman's capsule or glomerular capsule. See, this is the capsule. This one is the parietal layer, outer layer. It's lined with the simple squamous cells. See here, this is the capillaries. Okay, this forms this glomerulus. This is the glomerulus, where you can see the tuft of capillaries there. So there is an afferent arteriole, and this efferent arteriole will be there. That part or that area forms the vascular pole. Here the opposite of that, you can see this, the urinary pole. From there he can starting this proximal convoluted tubules. You can see the proximal convoluted tubules. Then here this capillaries, this inner layer, outer of this capillaries, okay, that forms the visceral layer of the Bowman's capsule. There it's lined with the special cells that are the podocytes here. There is a podocytes there. Then the space between the parietal and visceral layer, that forms the capsular space or Bowman's space. This is the capsular space or this Bowman's space. Okay. Here close to this vascular pole, there is a arteriole. Can see here. You can see this is the here. This is the distal convoluted tubule. See the distal convoluted tubule. Okay. Then, so the cortex, this kidney can identify with the help of this renal corpuscles, this round structures. These are the renal corpuscles. Then deeply stained tubules, that are the proximal convoluted tubules. Then the slightly stained tubules, those are the distal convoluted tubules. Also, you can see the venules and arterioles. Okay, interlobular vessels also there. Then next is this Justaglomerular apparatus or just Justaglomerular complex. Here you can see this is the renal corpuscle. You can see there is an afferent arteriole. Here we'll get this afferent arteriole. This is the distal convoluted tubule. Here you can see the Justaglomerular cells also there. Okay. So this Justaglomerular complex or apparatus includes mainly three structures. That is macula densa. There is the macula densa. It's the macula densa. You can see in this distal convoluted tubules, DCTs. Then Justaglomerular cells can see in this afferent arterioles. Then there is the extraglomerular mesangial cells also there. Extraglomerular mesangial cells. Here, this one. This is the Justaglomerular apparatus. See here. Here, this is the entire thing, that is the renal corpuscle. Here, this is the Bowman's capsule. Here, this is the outer layer lined with the squamous cells. Here, this is the glomerulus, where you can see the capillaries. That outer here, this is the visceral layer. There you can see the podocytes. See the shape of the podocytes cell. It has a foot-like process which attached to this wall of this capillaries, this podocytes. Okay. Then here, this is the afferent arteriole. So blood is entering into this glomerulus. Here, this is the, it divides into this capillaries. From there, this exit through this afferent arteriole. In relation to this afferent and efferent arteriole, there is the distal convoluted tubule. Okay, it's lined with the cuboidal cells. In closely in the part attached to this afferent arteriole, these cuboidal cells change to form columnar cells. Those are the macula densa. Here in this afferent arteriole, this smooth muscle cells present that when enlarged to form the justaglomerular cells. Arteriole smooth muscle layer is there. That's those cells enlarged to form this one, that is the justaglomerular cells. Okay. So in between these three structures, you can see outer there are some. Here you can see the extraglomerular mesangial cells are there. See here, you can see the extraglomerular mesangial cells. Inside is also you can see this is the intraglomerular mesangial cells. These are the mesangial cells. So this extraglomerular mesangial cells which supports this justaglomerular complex, which supports this area. Then intraglomerular mesangial cells which act like smooth muscle cells cause construction of this glomerular capillaries. Okay. Then here, so here you can see this one is the macula densa. Okay, this is the distal convoluted tubule. Here cuboidal cells closely relates to the afferent arterioles. It modifies to form this columnar cells. This one here, which senses this potassium load, sodium and potassium load in the luminal fluid. Okay, that is with this one controls respond to any change in the concentration of solutes within the filtrate. Okay, this act as osmoreceptors. Here these cells. Then here this one is the justaglomerular cells. This one secretes renin. Okay, they also respond to any change in the blood pressure in the blood which entering through the arterioles. Okay, so these cells secrete, store and excrete this renin. That is the function of this macula densa and this justaglomerular cells. Here you can see these are the mesangial cells. These togetherly forms the justaglomerular apparatus. Here, that's all about the structure of the kidney. Then some microscopic structure of ureter. When we take a section ureter, here this is a transverse section. See, this one is the lumen of the ureter. See this inner layer, inner to outer, this is the mucosa. Here is the mucosa. This one is the submucosa that forms the lamina propria. Then here you can see this is the muscular layer. Then there is an outer layer that forms, this one is the adventitia, this outer layer. So coming to this mucosa here, so this is the lining epithelia. See the lining epithelia, it is stratified, that is the transitional epithelia. So lining epithelia of ureter, that is the transitional epithelia. We'll see the structure. It shows folds. Okay, that is the star shaped appears. So the lumen appears as star shaped. Okay, this mucosa is folded. When it gets distended, this fold disappears. Then next layer here, this is the lamina propria, where you can see this connective tissues. Okay, connective tissue is there. Then see here this muscle layer. See, this one is the inner longitudinal and this one is the outer circular. Okay, because in GIT there is inner circular and outer longitudinal. Here in this urinary system there is the inner longitudinal and outer circular. In the lower part of the ureter there is inner and outer longitudinal, middle circular. See this outer layer, this is adventitia, where you can see this adipose tissue, fat cells also there, connective tissue fibers there, this arterioles, venules, lymphatics there in this adventitia. So here is the ureter, this lumen, that is the star-shaped lumen. This is star-shaped lumen. Lining epithelia, that one is the transitional epithelium. Then next is the muscle layer. that is forms inner longitudinal and outer circular. Then outermost layer, that is the adventitia. Then coming to the structure of this transitional epithelium. So this pelvis, this calyx, ureter, then urinary bladder, then the proximal part of this urethra is lined with the transitional epithelium, that is also called urothelium. Okay, see here, this is the lamina propria, this part is the basement membrane. You can see the basal cells are columnar or cuboidal. Middle cells, these are polygonal. See the outer shaped outer cells, these are some umbrella shaped cells, large ones. See the umbrella, some in cells you can see two nuclei, these are binucleate cells. So these are the umbrella shaped cells, outer. Okay. Then here you can see the structure of this urinary bladder. So here when we take a section of the urinary bladder, okay, here in this first one, this is the lower view. See, this is the mucosa, inner outer there is a mucosa, this is the muscle layer, then outer there is serosa or adventitia. Here you can see this is the serosa. Okay, so this is the mucosa, it shows folds. Okay, here this is the mucosa. See, this is the lining epithelia. See, it's stratified. That is the transitional epithelia or urothelia. Then here you can see this part, this is the lamina propria, this is the lamina propria. See the muscle layer, that is thick. It consists of, there is inner longitudinal, then can see the middle circular, then outer longitudinal. Okay, then outermost layer, that is the serosa. If it is covered with peritoneum, that is from the superior surface and all, that is serosa. In the posterior, that base, there is no peritoneum, so there it forms the adventitia. Here in between the muscles, you can see some connective tissue also there, that forms the interstitial connective tissue. In between this muscle layer, there are connective tissues there that forms this interstitial connective tissue. So the structure of the urinary bladder, here there is the folder, that is the mucosa is there, lining epithelia is transitional, then lamina propria, this lining epithelia and this lamina propria forms the mucosal layer, then this is the muscle layer, then outer serosa or adventitia. Then here you are seeing this the transitional epithelium. See the transitional epithelium. See the basal membrane, the basal lamina. This one is the columnar cells, this is basal cells, columnar. Middle cells, these are the polygonal cells. See the superficial cells, these are umbrella shaped cells. These are the umbrella shaped cells. Okay, so when the bladder is empty, when it is in a relaxed state, okay, relaxed state, this is the appearance of the cells, should be like this. Okay, so lining epithelia, that is urothelium. Okay, when it gets filled, gets distended or structured bladder, the superficial cells becomes flattened and appears as squamous cells. Okay, then basal cells change to the cuboidal cells. Okay, so it appears as stratified squamous epithelium. Okay, this lining epithelium is transitional. So when it gets stretched, it appears as stratified squamous epithelium. Okay, additional to that, here the superficial cells, these cells are, these are well developed cells, okay, connected by, there are some intercellular connections, cellular junctions are there, and also the cytoplasm contains glycoproteins. Okay, these are the uroplakins, this uroplakins, which forms urothelial plaque or this plaque over the surface of the cells, urothelial plaques, which act as a urinary barrier, okay, which act as a urine barrier, which protects this one, the inner cells, from the toxic effects of this urine. So here in the superficial cells there are some proteins are there, glycoproteins. Those are called the uroplakins. This uroplakins forms this urothelial plaque over the surface of the cells which act as a urine barrier. Okay. So that's about this transitional epithelium. Then here you can see this is the male urethra. So male urethra, this proximal part, okay, is lined with transitional epithelia. Here the neck and this one urinary bladder. Here you can see the neck, this part. Then this one is the prostatic urethra. Here it travels to this prostate. Then this is the membranous urethra, so this urogenital diaphragm. Then to the penis, that is the penile urethra or the spongy urethra. So the proximal part is lined with this one, that is the urothelium. Okay. Then here this membranous urethra, this part of urethra in the bulb of the penis and the body of the penis, that is lined with pseudostratified columnar epithelium. You can see here this mucosa in this glands that is lined with stratified squamous non-keratinized epithelium. In case of females, the proximal urethra that is lined with the urothelium, the distal part that is lined with the stratified squamous non-keratinized epithelium. So that's about the microscopic structure of a renal system.